theaters.org or call 323-GO-1-FORWARD.
Last block on Kababayan LA, your last chance to talk to Dr. Mariano here. He is not only knowledgeable, he's able to explain things to us, and that's why we're also getting a lot of calls. Dr. Mariano, saan ka daw kay Sir nagtatrabaho, kung saan kanila pwede makausap? Anong branch ba?
So actually, I work primarily out of Kaiser, West Los Angeles. But in terms of taking patients at this point, I'm actually not taking patients at this time.
Oh, no.
Yeah.
Okay.
However, I would recommend that, one look to see, if there would be other Kaiser doctors that one could see, and I'd recommend going to the Kaiser website.
I think the thing is that they're connecting with you because you also speak Tagalog and you're so personable. They feel that they can ask you anything you want, and that's a good trait for a doctor also, no? And that's something that they should look for.
Yes. You should be very comfortable with your doctor. You should be able to communicate with them, feel that you're being heard. These are important qualities in any doctor.
Pero hindi ka na nagtitake ng clients. Maybe we should have you back here more regularly so you can consult with them. Riza is on the line from West Covina. Hi, Riza.
Yes, hello, Janelle, Dr. Mariano.
Yes, go ahead.
I have a quick question because I have a friend who's diabetic and he's almost in his 70s. But he's had episodes of forgetfulness and also to the extent of disorientation to the place that he's supposed to go. And I was just wondering if is there any relation to his diabetes? Because I'm a nurse myself, and so I told him that.
Okay, thank you so much. I'm so sorry we have to cut you when we hear the feedback because it hurts everybody's ears here. Yes, go ahead.
So, I would actually recommend that he sees his doctor. One of
May
the
connection
issues,
daw
may
ba yan?
connection, kasi what we know is that with diabetes, again, when the blood sugars are elevated, it does actually lead to damage to the brain because it affects the blood vessels in the brain and can contribute to the development of dementia or memory loss as one gets older. And also sometimes the blood sugars could either be too high or too low. And those two situations would lead to sometimes memory loss and confusion. So those are very, very important issues that need to be addressed with his doctor.
So ang dementia pwede siyang effect ng diabetes? Okay.
Yeah.
Wow, that's really scary. That's why you always need to consult with your doctors regularly to make sure that everything is okay with your health. Last caller for the show, Roberto, is joining us from Lakewood. Magandang hapon sa'yo.
Magandang hapon din. Gusto ko lang pong tanungin kung bakit ang isang tao na mapayat, hindi tumataba, ay hindi pumapayat. Hereditary po ba ito? Or mayroon po bang...
Okay, thank you so much. We're getting feedback. I don't know where that's coming from. But yes, go ahead. Ang payat, kahit anong kainin, hindi tumataba. Ang mataba, kahit anong diet, hindi pumapayat. Ano ba yan?
So I think, syempre, very frustrating yon. And I think one of the things that we do have to acknowledge is there's a big genetic component too, as well. Pero importante rin na maging mas proactive tayo. That, even though we may think we're cutting down what we're eating or we're exercising, we're maybe not exercising enough. When it comes to daily activities, talagang nire-recommend at least 30 minutes a day, kung pwede, every day of the week, kung maaari. But maybe 3 to 4 times a week at least. Nag-walk or any type of other exercise. And then when it comes to diet, ang maganda doon na yung tinatawag na portion control. So bawasan yung kanin, bawasan konti ng ulam, and working on that. But a big component of that is genetics.
Okay, what about yung payat na ayaw tumaba?
Ganon din. Is I think that people's metabolisms or how our body processes food and stores food has a genetic component. So usually that's the case as well.
Okay. Now, last 1 minute on the show. If you have anything that you always remind your patients of, if there's one good health advice that you can share with us this afternoon.
I would recommend that one just stay active, physically active. Na yung magpark na malayo, maglakad sa, don't be lazy.
Okay.
Because we know that exercise really has such an important role in the prevention of a lot of disease. And that's one of the things that I think as Filipinos sometimes we don't completely
Right,
adhere
right.
to. Yeah.
So magpark sa malayo para mapilitan tayo maglakad. Just don't walk in heels. All right. Well, thank you so much for joining us today, sharing your expertise. Sana po marami kaming natulungan ngayong hapon sa inyo, and we'll see you again tomorrow. Ako po si Janelle So, ang inyong kababayan dito sa Los Angeles.
Kumuha ng serbisyo ng teleponong pambahay na mas mababa sa 25 cents sa isang araw mula sa California Lifeline Telephone Program kahit naputulan na ng serbisyo.